Welcome, everyone. I see a lot of folks popping on now. There's directions in the chat. If you want to change your name on your screen so we can see what organization you're joining us from today. And there's not a lot of room to put everything. So if you want to put your first name, the agency, and if you want to include your pronouns, that's great. We'll get started in just a moment. It's 10:01, and we'll give people another minute. Thanks to everybody who's upgraded your name. That's terrific. If you want to turn on your video, we'd love to see you. We're going to have an interactive session today, so we're excited to see you and to have you participate. Great. Welcome, welcome. We're at 10:03. I'm just going to wait one more minute to give folks a chance to come on. You'll see, if you haven't heard this already, in the chat directions, if you want to rename yourself, first name, the organization that you're representing, and your pronouns, that would be great. All right, so we're going to go ahead and get started. Just if you could put your name and your pronouns in and rename yourself, the directions are in the chat. So thank you for doing that. I invite you all to turn on your video, at least in the beginning, so we can see who's in the room with us. Welcome, welcome, everyone. We're really excited to have you here today. Sarah, you want to go ahead and you can share the PowerPoint? Great, thank you. So good to see you all. Today we're going to focus our session. This is our second session in the Rising Together series through the Office of Workforce Development for the City of Boston. My name is Susan Lang, and I'm consulting on this webinar series, and really excited to be here. I see some familiar faces of folks from work in the past, so terrific to see you all. Our session today, as I said already, is going to be interactive. So we're going to do some breakout groups. We have some polls, and we really want to hear from you. So I just wanted to put that out there right up front and center. If you have any tech issues, you can enter it into the chat. So Anna and Sarah are here from OWD, and they're going to be checking the chat, and they'll be able to troubleshoot if you're having any tech issues. Sarah, you want to go ahead and advance the slide? We can do the next one. So here's what we're going to try and accomplish today. We have a couple of major goals. We really want to focus on strategies for working with youth and young adults who are experiencing homelessness. And we're going to ground our conversation first and foremost in who the population is in terms of the key demographics and characteristics. We want to talk about common language and tools that as providers we can use, so we're speaking the same language, so we can better position ourselves to work directly with the young people. We're going to delve into some effective practices for case management and for cross-system collaboration. So folks who are with us today, you're either representing programs that are serving young people who are experiencing homelessness and focused on supports to eliminate that as a barrier, or folks who are providing employability, employment, and workforce development context. So if we could pause for a second, I want to understand who's in the room with us today. So if you could raise your hand if you are representing a workforce development or an employment or employability program. Just to see who we have. Others, I think there's more. We have 8. Raise your hand if you're representing a program that's providing employment or employability services. If you're driving and you want to, you can unmute and shout it out and add to the count. That's fine. So it looks like we have about 12 folks or so, maybe a smattering more of folks representing employability programs. Is that everyone else is coming from providers that are focused on homelessness services? And if I'm making the assumption, if you're not, can you put that in the chat if you're representing a different organization? We have some folks who were representing both. I see that. Thank you for that. Wearing 2 hats today. I appreciate that. All right, great. Thank you for that quick check-in. So we'll continue on. So we're gonna focus really on the cross-system collaboration. So we can see here that we have representatives from folks working on housing services and folks working on employment and employability services. And our time together today is really going to focus on collaboration and some tools and techniques, both for collaboration and thinking about case management. Why don't we go ahead and advance to the next slide, Sarah? Okay. So here's our agenda for today. One, we're just going to ground ourselves first and foremost on understanding the population. We're going to identify some challenges that young people face in being served across multiple providers. So we know that young people may go to an employment program, but they might need other services that you can't provide. So we're going to talk about some of the challenges that we've heard from young people that they face. We're going to talk about the principles for coordination across providers. So you know, I think we can't all be necessarily all things to all folks, but you know, working collaboratively is the way to provide a stronger support network for youth and young adults. We're going to talk about how to do that coordination at both the organization level and the staff level. And we have some really clear strategies on how to do that. We're going to take time for a quick break because this is a 3-hour session. So we want to give folks a little 10-minute break, breathing room in there. And then we're going to, the last part of our session today is focused on implementing a shared case management framework, really with the aim of optimizing collaboration. Next slide. All right, so we're going to start with a poll this morning. We really want to hear from you, and it's open-ended. So let's go ahead and put this up. So we want to understand, what are the greatest challenges to serving youth and young adults experiencing homelessness? So we have the stigma or discrimination associated with folks experiencing homelessness, work placements that might not be accessible or might not be of interest to the youth and young adults, technology, maybe young people don't have a computer or might not have anywhere, if they have a smartphone, nowhere to charge it or plug it in, lack of housing options, especially for episodically unhoused young people. And when I talk about episodically unhoused, we're really talking about couch surfing, young people who might not fall under the formal definition of homeless, but we know that they're couch surfing. For pregnant and parenting young people, lack of childcare or lack of transportation. So it looks like lack of housing options is clearly an issue, with 87% of you weighing in on that. And if there are other challenges that are not in this poll, you can add to that list. If you see question number 2, there's room to add. So we'll give you just a few more seconds to, if you haven't been able to fill out the poll, that's great. It looks like most of the challenges are evenly split except for the lack of housing options. That is far and away the biggest challenge. Okay.
Susan, I just shared the results. I think we had most people respond.
Yep, I'm seeing it. So it looks like, yeah, 73% we have. That's great. All right, thank you for that. So let's go ahead, Sarah, to the next slide. So we want to ground our conversation and then make sure we're all on the same page about who the young people are that we're talking about today. Young people who are experiencing homelessness in the city of Boston. You know, in particular, those who are being served by multiple providers. Next slide, please. So this data is really a moment in time data, so it doesn't represent the entire population. And this comes out of research that was done and compiled into a report by the United Way. So 92 individual youth and young adults are living on the street or in the shelter system, and those are young people who fit the formal definition of homelessness, and 119 are parenting and living in a shelter system. Next slide. And then we know, the data shows us, young people, there's a disproportionality in terms of who is at risk for homelessness. So 51% of youth and young adults experiencing homelessness identify as Black. 45% identify as Latino or Hispanic. 26% identify as LGBTQ+, and 33% have been either in the foster care system, and nearly half report being detained or in either the juvenile justice system or in the adult justice system. But we know that that doesn't capture everyone, and those numbers are for those who fall under the formal definition of homelessness. When we opened this session today, I talked a little bit about the young people who fall under what we categorize as episodically homeless. And we really want to capture the magnitude of the issue, because we know that that is a major challenge for greater numbers of young people. So episodically homeless, young people who are couch surfing, right? So they may have a place to sleep one night, or they're going from friend's home to friend's home, maybe at an auntie's another night. And this data really speaks to those numbers. So as of January of 2020, an estimated 481 unaccompanied young adults, so ages 18 to 24, were episodically homeless on any given day. It's not the total population, it's just, that point in time count, just as the earlier data. And then looking at public school data, and this is for the state of Massachusetts, almost 25,000 public school students experience homelessness over the course of a year. And that's for the state. And 15,000 were doubled up and living with other families or in other households. So that's really the couch surfing population over the course of a year of young people who were also enrolled in public schools. So, the numbers of young people who are not enrolled, you could deduce that it adds to that number. So it's a significant number of the population. And then we want to keep front of mind who the young people are being served. And so there was focus groups with young people who were participating in programs. And we wanted to share just a few of their thoughts on receiving services from programs. And here's a couple of key things that they told us. One, so they're not necessarily drawn to programs for money. That they want to go to programs also because they're going to get services, and they want to get on a path to success for themselves. The money is a positive thing, but it's not the only thing that they're drawn to. Inclusive and supportive environments. Those are the incentive for young people to show up. They want to feel that they're coming into a program and into an environment where they are truly welcomed in and they're offered support by the staff. Daily supports from staff are really helpful. So reminders, support that they could get around barrier eliminating tasks. So helping them with transportation, helping them with housing, helping them with childcare, things that are keeping them from getting to what's next in their lives. So those supports are really, really helpful for them. Participation bonuses and higher hourly wages incentivizes participation. So young people are more, they said that they're more inclined to go to the program if these things are in place. And then lastly, coordination across providers to avoid duplication and frustration. What we heard from young people is, if they're going to an employment program, for example, and they've gone through the intake process and they've met with a case manager who asks them a lot of questions to understand what their challenges are, what their strengths are, what they're bringing to the table. but then housing is a major barrier for them. So then that provider could refer them to a housing services provider, and then the young person goes through all those questions all over again. They report it's really frustrating for them to have to repeat that whole process and go through it multiple times based on getting their needs met. So they're asking for coordination across providers to avoid that duplication and the frustration. Okay. And so this speaks to, sort of the multi-system work, right? So young people will oftentimes, they're seeking out one type of services, right? So they're looking for a job, they're looking for housing, and they will go to a provider who might meet that need. But oftentimes, and you all know this, some of you are wearing two hats, but oftentimes programs aren't able to wear multiple hats, and they're not necessarily a one-stop shop. So young people will get a referral to another program, and sometimes it is a cold handoff, meaning they're given the name of another organization to go to and maybe a person to contact, but they're expected to go there on their own, and that can be re-traumatizing for a young person to be able to go to another program where they don't have a connection, to retell their story that they already told, and it can be re-traumatizing for them to tell their story over and over and over again. And then young people are left to figure out their own next steps and negotiate that system, which can be really tricky. I think for adults and folks working in the space, it can be sometimes really hard to figure out who else to be able to connect to make sure that you're getting the support that you need for your youth and young adults. So imagine being in their shoes. It can really be challenging to figure out how to get all their needs met when they're trying to figure out a system that isn't crystal clear to them. So tell us a little bit about your experience. We want to hear from you. As a provider, what challenges have come up when you're trying to coordinate with other service providers that are also serving your same young people? And so if you can put into the chat what those challenges are, and we want to hear from you, we'll lift that up.
So it looks like from Candace, we have a comment about service area ties.
Yeah, Candace, can you tell us a little bit more about what you mean by that?
Yeah, so I work in Quincy, the shelters in Quincy. And so sometimes we have kids from all over technically.
Mm-hmm.
And sometimes if I'll contact like a different region, they'll say they only service Boston, or they only service Plymouth County, or they only service here. And so the youth that's physically residing in Quincy, but maybe from Boston or a different area, is no longer eligible for services due to their physical location.
Gotcha. That's really helpful. Thank you. I'm seeing a lot of, multiple responses in here about lack of follow through. So I'm assuming, and by all means, please chime in. So if you're referring a young person, one of your young people, to another agency, you're seeing a lack of follow through by the agency that you have referred them to. Is that right? Waiting lists, long waiting lists, difficulty maintaining appointments, communication with clients and struggling with deadlines. Is that So Alex, the maintaining appointments and communication with clients struggling with deadlines, is it the other providers struggling with deadlines or the young people struggling with deadlines?
Oh no, sorry, that was a little unclear. Yeah, it's the young people struggling with deadlines, both
Okay,
with me or external.
okay. So there's two things here, right? So it's, you know, what are the challenges with working with providers, and then what are the challenges that the young people might be exhibiting that make it even harder too? Duplication of services. Other thoughts that make it hard to coordinate across providers? Anything that's not lifted up here already? How about Shirley, you mentioned agencies not wanting to let go of clients. Can you tell us a little bit more about that? For anyone else experience that? So I'm assuming the first agency that has been working with a young person, feeling like they own that case, right? And maybe not wanting to share information. Is that correct? Anybody experience something like that?
My experience was a little bit different, not so much the agency not wanting to let go, but the agency having to wait for a court date to be released to
Okay.
be able to transfer of service. Example, a client that may be transitional age with DCF now trying to get DMA services. Again, it could be some duplicate of service, so they have to wait.
Okay, I'm sorry, I missed the end of that.
Yeah, I'm sorry, I was hearing a lot of feedback too.
Yeah.
I was saying one of the examples that I'm still hearing it actually.
Okay, if you're not speaking and you can mute, that would be great.
Hopefully this is better.
Yeah,
Okay,
great.
great. So I have a young adult that I'm actually working with coming from DCF, and they have a court case that they're actually trying to relinquish their service on their ends before she's eligible for DMH services. And so it's not so much that they're not wanting to get through, but it's just a process that's legally held up. That
Gotcha.
I'm experiencing that. And so
Okay.
trying to get her housing or into like a proper GLE program has been a huge barrier. And it's been over a year that we're actually waiting.
Oh my goodness.
Yeah.
Okay, so that's something that's very different than what I read that Shirley's comment as. So really folks getting held up in the system, right? In the care and protection system, right? And it holds them up from being able to get served is that correct?
For my example, Shirley might be different.
Yeah. Shirley, did you want to weigh in? Is that what you were talking about, or were you talking about something else? You're muted. Nope. Are you able to unmute, Shirley? No. There we go. All right, Shirley's connecting to audio, so we'll We'll hear from you in 1 minute. So Anna, you weighed in here that brings up an interesting issue of eligibility criteria, right? Which, did you want to say a little bit more about that?
Yeah, I think to that point of sometimes the systems might not align with one another. There might be some external barriers to what programs a person is able to participate in, that may come down to kind of a technical issue. If you're receiving services from one agency, you may not be able to receive them from another, or
Mhm.
you may not, there may be some issues around what sorts of supports you can receive simultaneously, and that sometimes limits what resources that might be available to a young person that at an agency level we can't always overcome just through, it's more of a systems issue, which is
Mhm.
something I hadn't thought of.
Yeah, no, that's a really important point. Okay. Shirley, were you able to connect? I'm looking, I think we might have, did we lose? I think we might have lost Shirley. We're not sure about that. Any other last thoughts around issues around trying to coordinate with other service providers? So I'm hearing systems issues, right? Of what Anna was just talking about. Poor follow-up. And I think both on the part of young people who may be referred to another program, perhaps. Nobody has spoken to this directly, but I'm wondering, has anyone experienced challenges with getting another provider to follow up? Long wait lists and the constraints of geography on providers, that they might not be able to work with young people from every community or every neighborhood, that they're constrained in that way. So those seem like the big issues that have bubbled up. Anything else missing? Okay, Sarah, why don't we go ahead and we'll go on to the next slide. Thank you for that, everyone. All right, so we've grounded ourselves in some of the challenges that youth and young adults have lifted up in getting their needs met, and in particular in working with multiple providers. And you all just lifted up some challenges in working with other providers and in working with the population. And it's really complicated and it's really hard, right? So sometimes I think it might feel easier to go it alone, and to try to figure out how to best meet the needs of each individual young person by providing as much as you possibly can to them. But you might be limited in terms of your capacity and what your own agency actually is able to provide. So we want to spend time today really talking about coordination and collaboration, because in the long run, it's easier to not go it alone and to work with organizations that might be providing services that you're not able to offer to better meet the needs of young people. All right. So we're going to talk about developing service networks and collaboration and coordination across those. That's going to be the focus for this next section of our session today. The goal here in collaborating and coordinating is to provide a holistic and coordinated set of integrated services across providers and reduce duplication, right? So I think we want to make sure that we're able to serve the whole young person, and they have a rich set of needs, and to be able to serve them well, we want to tap into all the resources that might be available to them. And we want to apply the concept. So how do we do that? We'll apply the concepts of partnership and network development in two different ways, right? So we want to think about the collaboration, the coordination at a systems level, looking at the workforce development program and service system, and looking at the housing service system, and coordinating across those two systems to set up delivery so that we're better able to meet the needs of young people, and then to do that at a staff level as well. And that's it's work, and it's a complicated proposition. So we're going to work through that today. Next. So here are the elements of partnership and collaboration. We're going to talk a little bit about these in more depth now. So there are 6 key elements when it comes to collaborating. Sarah, you want to go on to the next slide? So the first 3, one is shared purpose, setting joint priorities and a sense of collective ownership. So shared purpose, for example, working with young people who are experiencing homelessness, the shared purpose could be stabilizing the population through housing and employment. So the two systems that are represented today, the shared purpose for collaborating together is coming together to make sure that the service population gets stabilized, gets their needs met, is able to secure housing, and able to work on employability skills and secure employment. The second element is having essential people at the table. So being really intentional about that. So intentionally engaging folks across both sectors, housing specialists, case managers, career specialists, and having folks who could meet the needs of young people who might not be doing the same exact services that you're providing. And the third element is effective leadership. So we want to foster trust and distribute the power and decision-making and have an effective communication strategy. So, I think oftentimes we see in collaboration, folks develop individual relationships with staff at other programs. But we're talking here, we want to talk about systems level collaboration, and then we're going to talk about staff level collaboration, having program directors and managers at the table to help set up this framework and have really clear articulated agreements across agencies. It's going to help in the long run. Next slide. The fourth element is an adequate structure and support. So having dedicated staff who have the capacity to work on the collaboration, putting in place rules and processes to meet the goals, and structures that are clear for decision-making, and include good communication, and then using data and analytics to be able to share that information. Active collaboration, so all partners participate in the planning, and they operate with a shared interest. So if you're setting up a collaboration across multiple agencies, it won't work very well if you have, let's say you have 6 agencies who are in this collaboration, but only 2 are doing the planning and maybe 3 come to the table. You need all hands on deck. So really active participation from everyone. And then the 6th element is taking action. So identifying the resources and the methods for measuring the success to support the collective progress. So, having staff designated to gather data to share, and having someone from each organization as a coordinator will really help with the process of collaboration. Next. Okay, I talked a little bit, so we were talking about collaboration and partnership and having a network. And so, I wanted to just outline what the distinctions are between partnership and a network. So collaboration is the act of working together. But the terms mean something a little bit different. So partnership is a relationship between organizations or groups, and it's usually not a very big number, who come together for mutual cooperation to achieve a common goal. So you come together in partnership, and it could be, two programs that are working with youth and young adults to make sure that the participants get housing and employment. So you're developing a partnership, a collaborative approach to sharing a service system to best meet the needs of young people. A network is bigger than that. So a network is also, it's a group of people or programs who are interacting and cooperating, but it's more based on mutual assistance and support in relation to that common interest. So networks usually involve larger number of organizations. You're supporting each other around that mutual goal, but it goes beyond that. It's really collaborating with an eye toward the broader goal. So networks can work together, yes, to meet the needs of young people, but a network can also work together to do something like lobby the state legislature for additional funding for more housing supports for young people. You all lifted up early on one of the biggest challenges in serving this population. There just isn't enough housing available to be able to meet the needs of the population. A partnership can be you're working with programs to meet the needs of the service population and a discrete service population, but the network, you can move from partnership into the network to be able to focus on working collaboratively toward a bigger goal. And that could be for funding. It could be for visibility for the network that's sort of has a bigger frame around it. Thank you. Next slide. So we're going to talk a little bit about the organization level and then staff level strategies to enable collaboration. So we've talked about the 6 key elements for collaboration. And what's really important is to understand that there are 2 levels that we really want to focus on here at the organization level, and it's setting up structures in place to support that staff level collaboration, which ultimately is going to mean better and more coordinated services for the population of young people. So we talked about some of the, you already lifted up some of the challenges in working across providers. So now we're going to dig a little deeper. All right. So coordination at the organization level. And these are some really concrete steps that we outlined here to be able to start around building a relationship and a partnership. And oftentimes it does start with relationships. So you develop a good working relationship, and oftentimes that's at an individual level, right? So you may be working with you work for agency X, there's someone at agency Y that you've developed a really good working relationship with. You are able to refer your young people. So let's say you're an employability program in agency X, and in agency Y, they're focused on housing services, and you're able to refer your young people into agency Y to get some resources and housing supports. But if your contact person and the person that you've developed that relationship with in agency Y leaves, the relationship often goes with that person, and then you're left to figure out how to meet the needs of your young people, either with somebody new in agency Y or within another agency. And so then you're starting from scratch all over again. And frankly, in this moment in time where there's been, you've heard lots about the Great Resignation or the Great Reshuffle, and a lot of staff movement that makes it even more challenging. So we're proposing here a framework that's starting at the organization level to set up a system for collaboration. So if someone leaves, the whole thing doesn't fall apart and you're still able to meet the needs of your young people. So the first thing is, and these are just really clear nuts and bolts steps that you can take to develop at the organization level, this collaboration across multiple agencies. So number one is designate a point person. Who's going to set the framework for your organization? Is that a manager? Is that a case manager? Is that a program director? But designating somebody who's going to be on point for your organization. Developing a plan for communication. How are you going to talk in that across the partnership and across multiple organizations? Are you going to do that in writing through email communication? Are you going to have sort of a group thread that everybody can weigh in together? What is the plan to communicate and how frequently? You want to make sure that you develop tools for sharing information. You know, if to set up collaboration, you know, there's confidentiality of the young people, data collection and data sharing agreements. So putting those things in place before you come together to start sharing information will position you for success, because then you have those things in place, everybody's on the same page, and you've already agreed to what information you can share and will share, and how to do that confidentially. Identify who will have access to the data and how it will be shared. So if you're sharing information about individual young people, you want to make sure that data is secure. You're not sharing it over email, you're not sharing social security numbers, things of that nature. So you want to identify who's collecting the data, what the data is, confidentiality agreements, and then who's going to have access to it and how you're going to share that back out. And then develop a list of partnering organizations for collaborating and jointly serving the participants. So I'm going to pause for just a second there. Okay, thanks, Sarah. So it's an opportunity, we want to hear from you. So has your organization used a framework for collaborating with other programs such as this? So in the chat, if you could put in here, if you could raise your hand if you have, and then, so that's number one. And then we want to hear from you in the chat, what worked and what didn't work so well. So this is at the organization level, at the system level.
I see Isabel's hand raised and Candace.
Great.
Isabel, would you like to unmute? Okay. I don't know if Isabel's having, Candace, are you able to, would you like to unmute and give voice to your comment?
Sure. What's worked for me is the list of the partnering organizations, complete with the actual contact person and their contact information. So that's something that I like to do when I come on board, is typically send an email out to introduce myself to kind of everyone on there, that I'm like kind of like the new contact person, and kind of start cultivating those relationships with myself and everybody that kind of preceded me. That way they know kind of like who's in charge, and we can continue to have that steady flow of communication within the organization. So that's something that I found that's super, super helpful. And updating that information as things go, because we do know a lot of times there is, turnaround and people change in positions within the agency. So just to keep that list updated as well, so you have the correct information to contact people.
That's great. And Candace, do you have formal data sharing agreements? Is there a way that are there things that you've put in place at a system level to be able to share information about your program participants with those partner organizations?
So typically it's this information is usually shared when we have like our COC meetings that are usually kind of like annually or a few times quarterly, I should say they're quarterly. And there's like a report that kind of goes in after that. And that's where like all the updated information goes out. And yes, there's typically like releases, that are signed and confidentiality agreements within the partners and organizations that we work with. That way, if we're providing updates, if we're sharing like a client's name and a success story, that we're able to kind of do that without like infringing on anybody's personal rights or data breaches. So yes, the answer is yes.
Okay. That's great. Thank you for that. Anyone else want to speak to your experience in setting this up at the organization level? Because we're going to talk about the staff level in a second. Either setting up data sharing agreements, any frameworks you've put in place, like do you have, do you meet with all the partners? Is it monthly? So Candace, you just talked about quarterly. Is there anyone else who wants to share setting up a framework such as this? And then we would love to hear, and if you have, what worked and what didn't work so well? Like what was really hard about that? Anyone else experienced setting this up?
Can say something.
Okay.
Cool, yeah. My name is Mairead, and I work in the Youth Harbors program at JRI Health.
Great.
And we meet as a team bi-weekly, and our ability to meet even remotely is pretty well. We collect kind of a database on Google Teams of all the different resources that we're aware of. But I think the problem is just that it becomes outdated and needs, if not quarterly, like maybe monthly updates, which a lot of case managers just don't really have the time or the energy to put into it. So that's maybe a challenge there.
Okay, that's helpful. And Mairead, let me just ask you, so if you meet every other week, is it within your organization or across your partners?
Yeah, it's within our organization. We haven't established meetings across networks or partnerships really, but it is a helpful thing to think about to bring to our next team meeting.
Okay. So so what I'm hearing you say, and tell me if this isn't right, is that even at an organization level, the information gets out of date fairly quickly, right? So it sounds like you keep a track of all resources. You're within the same organization, so data sharing isn't necessarily an issue because you're still within that same organization, but the resources still need to get updated really, really frequently. So we could assume that, then doing something of that nature across organizations is an even greater challenge, right?
Totally agree. Yeah.
Yeah. Thank you for that. Anybody who's doing this across multiple organizations, sharing information about your participants?
I can share.
Great. Thanks, Nareda.
Of course. So I work for the Garnet Product Academy in Austin, and we have a committee of child guidance where we meet with different partners from different network and to provide counseling services to our most needed student. So we come together every Thursday and we discussed, high need students, referrals, etc. So different organizations comes in with different counselors And the system that we have in place, as you mentioned, we have a very clear system where if anyone's, for whatever reasons are not part of this meeting or committee, anyone can pick up very quickly. So there's a live document that we record important and useful information for the next. For instance, if one of our counselor or interns needs to leave, the next one that comes in has pretty much a understanding to kind of grab on and continue the service with the student, if that makes sense.
Okay. Great, that's helpful. That's really helpful. Okay, thank you for that. Thank you for sharing. Let's talk a little bit, we're going to talk a little bit now at the staff level. So what happened? So, I'm hearing, there doesn't seem to be a lot of, and because I haven't heard from you yet, but so correct me if I'm wrong, in terms of setting up at the organization level, a framework for collaboration. So at the staff level, and my first example was, staff, you have a relationship with somebody, the staff person leaves, and then that sort of falls apart. So again, the rationale to setting up at the staff level is really important. And Anna, you're weighing into the chat. So, putting those data sharing agreements, the confidentiality agreements are really in place. So at a staff level then, so if you have it at the organization level, when you're working in staff, putting in a really consistent framework to be able to share across programs is really, really important. And this will help if you have staff departures, that the whole bottom doesn't fall out because you've put a framework in place. So setting regular meeting dates, having agendas for the meetings, identifying which cases, which young people you're going to talk about at a particular meeting, preparing for that meeting. So, what information are you going to present about the young people that you're going to talk about in that particular meeting? What are their successes? What are their struggles? What do you need help with? And what do you want to come together with your partners around to make sure that you're supporting each individual young person as best as you can? Taking notes in that session and documenting the decisions that are made, what action items are listed and what follow-up is needed, and who is responsible. So one of the things that folks lifted up earlier in this session was around lack of follow-through. Could be lack of follow-through from the young people themselves, but also lack of follow-through from some of the partners. So having a document that says, we met on this date, here are the decisions that were made about this person, that person, and that person. Here's the action items and follow-up that we need and who's responsible. Updating the case plans of each individual young person that was on the docket for that day. And then for the next meeting is to be able to start with that list of follow-up items, just to make sure that all the follow-through was taken care of, and that the steps were taken to make sure that the young person gets what they need in terms of the case management structure. So let's want to hear from you again. So tell us about your experience in collaborating, on individual youth and young adult cases. So if you could put into the chat, if you want to speak, or if you want to just unmute and tell us a little bit about your experience. We want to hear from a couple of folks if we could. About ways that you've collaborated with other organizations about, and sharing a young person in your service strategy.
I'm happy to go.
Great.
I like to usually meet either bi-weekly or even monthly on like shared clients. That way, if there are any like to-dos or updates, I can update them on my end, things that are going on. they can share whatever they're kind of like working on, and we can collaborate for the next step. This kind of helps keeps things like, and because I mean, case managers, a lot of the times, like, again, we have a long caseload, things can get lost in translation. This keeps things like kind of fresh on your mind and up to date, so you know kind of where it is. And I also like to kind of just send recaps in the emails. That way I can also like remind myself what was discussed, kind of what I need to do, set little reminders mail going forward. And this kind of like helps move with the process. That way the individual does not get lost in the systems. Both of us, the organization and myself, are kept in the loop on updating information moving forward. And also that the youth that's actually getting the services feels like it's working as well. And this is something that's been proven successful on my end, at least.
That's great. Thank you for that, Candace. Yeah, I think the having the documentation and the recap emails, it helps keep everybody on point, and you have in writing then what you have mutually agreed to, and then the young person feels like things are moving forward for them. So that's a really, really important point. Thank you for that. Okay, we have in the chat, so Isabel, so you refer out to Workforce Development Department, and they connect with agencies that have partnered with your agency. So Isabel, are you willing to unmute and tell us a little bit more?
Hi, I'm sorry, having some technical difficulties here.
No worries, no worries.
We're coming from Children's Services of Roxbury, where we're at the shelter part. So
Okay.
we have young families that we refer to our workforce development. And there they have like in-house, we have like parenting journey, and we now have ESOL classes that someone is partnering up with us that are coming in. But what we do is we refer to the workforce development department, and from there they have they collaborate and they send out to like a few of the partners that they have. So, but we have release forms. And one of the hardest things is actually keeping some of the families motivated to keep going so it would be more like their follow-up. And then the other one is the wait list, the long wait list.
Yeah. So the release form, tell me about what the release form is used for. What?
When we give out information, their information,
Gotcha.
so they have to, we don't just like submit, send their information without them. And when they come into shelter, there are questions that we ask, and then they sign off on it if they are okay with us sharing their information, like their phone number, their email address, and would they like to be a part of the workforce development and training. And so all of this is established when they first come in to the shelter.
Gotcha. So your program participants sign off on the release forms, so you can share the information about them to be able to make the referrals.
Yes, if they
Yeah.
want, if they're ready
Gotcha.
for it.
Right. And when you're making those referrals, I'm just curious, do you have go-to programs? So do you have partners or folks that you normally refer your program participants to? And what does that look like if you're making those referrals?
So what my portion would be referring to the workforce development, and there they have who they actually, whoever might be at the moment right now. Something new is like an ESOL class that I'm not quite sure what agency we partnered up with, but I just submit the referrals to the workforce development. I know that JRI is a huge place that they've used for some of their the participants to go to for training programs and ESOL classes.
Gotcha. And so do you help your young people get to those places that you're referring them to, or do they get there on their own? What does that look like?
So they basically get there on their own. If there's any trouble, like say it's a new family that comes in and they don't have any income, we will provide them like a Charlie pass or something like that. But they get there on their own.
Okay. Okay. And I heard you a little bit earlier say a little bit about their follow through sometimes though, right? That can be challenging.
What I notice is that when it comes to a training program for a job, I have seen them follow through more as opposed
Gotcha.
to a GED program.
Okay. All right.
Yeah.
Yeah. Sometimes, I think, one of the models that gets used in working with folks who are experiencing homelessness is sort of a work first model, with the idea being, having folks go into employment and then back into other services for them can often be a little bit more successful. So it sounds like that's your experience as well, right, Isabel?
Yes, that's what it seems like. I
Yeah.
hope they change that around. But I mean, I understand they're there with young children. They need to obviously be able to provide for their family, so they're thinking more of that. It's time to go to work as opposed to let me go to school.
Sure. Yeah. No, I get it. It's the reality. Okay. Thank you for that. Thank you for sharing. And we're going to move on to our next piece. So really, we have an opportunity now. We're going to do some breakout groups, we want to really focus in on developing a plan for collaboration. So setting up that framework for your organization. So setting up that shared purpose, designating who's going to be responsible in your organization if you're going to collaborate across multiple providers. What kinds of data will be collected and what tools? So things like Isabel just lifted up the release forms, those kinds of things, other data sharing agreements, what tools and how you're going to communicate, and who do you need in that partnership and in that network. So we have an opportunity here. You're going to take about 10 minutes or so to work in small groups. You will see in the chat is a tool to help you work through the steps in this process, because really this is a chance to roll up your sleeves and figure out how you're going to set up this partnership more formally. So this is a try it out moment for everyone. So we're going to go ahead and breakout groups, and then so pick a note, someone who will take notes, and it can be on this form that you can click on that. It's a Google Doc out of the chat, and someone who will facilitate in your group, somebody to keep the conversation going. But the idea here is to start to think about what framework you would set up for your organization, working in partnership with other organizations, to work collaboratively to best meet the needs of your youth and young adults. So we're going to spend about 10 minutes in the group. You're going to do some brainstorming and think about what those, what those things are, those steps are. We're going to come back together, and then we'll do a quick share out from the groups. Okay. Any questions? Everybody. So I had the privilege of popping into a couple of conversations, and there was some really good thinking going on. I would love to hear from a couple of groups about your conversation. I'm going to actually call on the group I was just in. Eddie Martinez was talking about bilateral communication, and he's at Fenway Health, and the use of a chat room to share information. So just thinking about, from even an internal to an organization, but how this could be used outside of that and setting up systems to share information about particular young people. So Eddie, I'm putting you on the spot a little bit here. Do you want to share a little bit what you were just talking about in terms of bilateral communication and the use of the chat room. I thought that was helpful.
Well, yes, thank you for putting me on the spot. Um, so yes, one thing that I mentioned was within our organization here at Fenway Health, uh, we are very lucky that each one of the case managers, and we're approximately 20 plus case managers in different areas. We all have different experiences. For instance, substance use in young adults, HIV, just different experiences. So what we have is an internal chat where we actually send out specific communications and questions, and we actually questions and request information from each other. So we actually complement each other as a group. We have from one of the case managers who has more experience in a particular field. Now we do the outreach because they also provide us with either the organization's website with their phone number or a person to contact with to actually provide additional support for our young adults. And not necessarily young adults, teenagers and outside and older adults. Um, so that's one thing that we do. And, the fact of establishing bilateral communication between one organization and the other, as opposed to as one individual, I think it's very important because um, a patient, as I mentioned, may be getting services in one healthcare facility and another one, but they're basically the same services. So we're actually duplicating everything, including housing. So there's a chance that there might be, say, for instance, a housing application that was submitted 2 or 3 times because the young adults went to two or three different places. Um, but just having that communication, that open communication with the other organizations is to figure out, hey, is there an application already established and so on, so there is no duplication. Um, so, it's not that easy, but it's also not impossible. The most important piece is communication between one organization and the other. When we do that at Fenway, we always place ourselves as Fenway Health staff, and providing the information, not one particular person, because that way either a provider, a nurse, a medical case manager, anyone who is working specifically and directly with a patient can actually provide that information. So it
Uh-huh.
doesn't have to be one specific person. So that's what we're basically talking about.
Great. Thank you for that, Eddie. How about another group? Anybody else want to share out? Is there a group that used the tool in thinking about setting up the framework for working across organizations at the organization level?
I'm sorry, can you repeat that? Sorry.
Yeah, are any of the groups, did you talk about, the tool that Anna put in the chat? Did you use that tool to think about at the organization level, what the shared purpose was, how, what other organizations you would want to come together with, what might that look like, and sort of putting that structure in place? I know that some folks in the groups want contact information of folks who are on the call today, which we will send out to everybody after the session. So you can reach out to folks who are on the call to start strategizing around the partnership and network building, which is great. I'm just wondering if anybody within your breakout group, you used that form to think about the structure and working with other organizations to serve the youth and young adults.
Yeah, so the group that I worked with, we did kind of go through that, and we talked a lot about partnering with agencies that as youth transition to adults, they can still receive services like once they age out of the youth programs.
Great. Do you want to, so did you talk about a list of programs? I mean, what did you, in terms of setting up that framework, what would that look like?
Yeah, so we didn't go through like a list of specifically of programs. We kind of just shared like, you know, our programs that we all worked at and how we would collaborate like with each other.
Great. All right.
Susan, we took a different approach in my group. We did use that form to some extent. I had the opportunity to work with Carla from Blackstone, Genesis, and Jennifer from Mothers for Justice, and Cherise from Children's Services of Roxbury. And what we did, we said that we would not like to duplicate any services. So it was very deliberate for us to be able to identify, first of all, what was the need we wanted to satisfy within the particular agency, whether or not it was employment and training. And we went about a strategy in terms that either a caseworker or a program manager will reach out to different agencies to see what they have in their agencies, as I said, not to duplicate any of these services, but to see where they could add and enhance programming that they had. Once that outreach was completed, we spoke about sharing the information with all staff, first being an all staff information meeting, and then coming up for an agency-wide around what that MOU should look like and the foundation rules to be able to start and form that partnership. We talk about surveying participants, clients and participants in terms of demographics and for post workshops. And then the meeting or the discussion took a nice twist where we started to talk about resources that we needed from our participants, especially concern around working with those K-5 where you know, the same barriers that were that existed, like the waiting list, the release of information, and more specifically, the use of the emergency housing voucher. And that's when we got cut off again. So that's what we had in our group.
Great. That's great. So you went into, you know, I think really good detail. It sounds like identifying, you know, you started from the framework of the participants, right? And the young people. What were their needs? How were you going to meet their needs? You know, how can you enhance your services by partnering? So that's a great way to start. So you really honed in on the shared purpose, which is, you know, it's a good way to begin the partnership. Another group that I was in talked about really spending time exploring other programs, getting to know other programs as the way to begin to explore the partnership, which I think is another good angle and approach. I'll just throw it out there. Any other group that wanted to share your conversation? Sounds like some really great ideas of folks thinking about the participants first and foremost, what they need, how to best meet their needs, and how to bring other folks to the table by getting to know the potential partners first, and then figuring out those steps to implement. So that's great.
Yeah, I'll mention that one of the groups I was able to pop into, I think it was Carla, and I can't recall the other individual, but we're working on kind of troubleshooting what might be sort of a case management or case conferencing type situation where they had a very specific situation they were trying to determine some resources for. But I think it was a really great example of how, you know, you sometimes can benefit from having those more formal relationships set up so that when you have a very specific situation that might be a little less formal, informal kind of collaboration that you need to work through, you know who that person is who may have done it before or may know where to go. So I think that was a really great, they sort of raised that up by there being kind of a need there for that conversation. But I really appreciate that. I don't know if there's anything Carla or anybody else in that group wanted to kind of speak to about, you know, how that would be helpful for you all, or what format for sort of a case conference like that you would like to see in place.
Thank you, Anna. Definitely more network. We need all the network we can. So if one gate is obviously closed, there are a whole bunch of windows open. So as Anna said, we are limited on not limited in resources, but limited in knowledge for those resources. So networking is definitely key for us. That way we can branch them off to different locations and areas where they can thrive.
That's great. That's great. Well, I think that's a good note for us to end on and transition. So there's an African proverb that says, if you want to go fast, go alone. If you want to go far, go together. So we're going to go into break. So we're going to take 5 minutes. But I'm going to leave you with that thought. Our goal here is on behalf of the young people that are getting served across these systems. We really want to go far in serving them well. So we're going to take 5. So it is 11:40. We'll come back at 11:45. Get a glass of water, take a bio break. And when we come back, we're really going to talk about a shared case management framework for collaboration. So again, to really strengthen that safety net for our young people. So we'll see you in 5. We're at 11:45. Welcome back, everybody. So we have a little more than an hour left, and we're gonna shift a little bit and talk we're going to continue with collaboration. We're going to talk a little bit more about case management and really taking a more systems approach. So in this last breakout session, I think you all are already starting the conversations about how to develop partnerships, how to work more collaboratively, and laying the foundation by starting with the needs of the young people and then figuring out what's missing as a way to bring other organizations and folks to the table. So that's a perfect starting point. Next slide, Sarah. So we're going to talk a little bit in this next part of our time together today. It's easier for us to have a conversation if we come together and we have some common language and tools and a service framework. So if we can get on the same page, we're going to be able to work more effectively together. We want to share program knowledge and effective practices. And you all lifted that up in that last session. We want to be able to close service gaps and reduce silos by collaborating. As we said at the start of our session today, no one program can really do all of it alone and be all things to all people. So in order to go further, we go together, and that we together as a network, it better positions each program by working collaboratively. And the example I gave before, so if you are coming together, you've developed a partnership, you're working across different providers, that collective energy, you can be a force to be reckoned with. So things like, even better meeting the needs of young people, yes, through partnership, but also doing things like seeking funding through the network, approaching the legislature for more resources, particularly for housing, which folks lifted up in the beginning as really a glaring need and not nearly enough in terms of resources. So a shared framework for case management, what are we talking about here? So what is it? It is, and this, when we talk about a shared framework, it doesn't mean a cookie cutter way of serving young people. And it also doesn't mean that it doesn't leave room for individual organizations to provide services in their own way. But having a shared framework gives some basic understanding and principles for us to work with together to better meet the needs of young people. So it's an agreed upon definition for case management. So if we're all calling an apple, then that's the good starting point. Understanding the stages of change for youth and young adults. So what happens in their brain, what is happening as they're coming in for services, and their readiness to receive services and to embark upon a journey for themselves. We're going to talk about that in a second. Using some common language. So, you know, when we're talking about case management and certain service strategies, having common language so that way, you know, the workforce development providers and the housing providers all understand what we're talking about collectively. Implementing some similar therapeutic methods. We'll talk about those in a second as well. So that's what we're talking about in terms of a shared framework. And why do we need it? So that way you can work across organizations and that you're on the same page when you're trying to serve the young people across the systems. It's easier to do that if we are using the similar tools. It's less confusing. There's less repetition for young people. So if you know, if a young person is being served by agency X and they're using, you know, a particular framework and using language around the service strategy, and then they go to agency Y for another set of services, if the language and the tools are similar, it's less confusing and there should be less repetition for young people. And it's more efficient, right? So we want to make sure that we can best serve them if we are able to do that across agencies. That is to the benefit of young people. So the framework. So having a common goal is a really important starting point. In some of the breakout groups, you already lifted up those. So what is your shared purpose and what were the shared needs of the young people? So the goal here, and I want you to raise your hand if you can agree upon this as the common goal and having a shared framework for case management. To achieve a state of well-being where the participant is stable and secure enough to meet their needs and they're resilient enough to withstand modest shocks, meaning, you know, you can, and we've all seen this, right? You're working with a young person, they're doing great, you've gotten them on a path where they seem stable, and then life throws them a curveball. So the goal would be in doing a shared framework for case management is to make sure that the young people, the participants, are stable enough that they can get their needs met, they're resilient enough to handle those curveballs or the modest shocks. It's not going to completely throw them off balance. Does that goal work? Is that a good common goal? If you can raise your hand. All right. And then the working definition of case management, just to, again, we want to make sure everybody's on the same page, that it's participant-centered and strengths-based, right? There's plenty of folks who will see this population as, you know, for the deficits they may have, but we really want to have an approach that's participant-centered and strengths-based. That's age and stage appropriate. So making sure that the services that are provided make good sense based on the age and stage of where young people are. You know, what a 17-year-old needs and what a 24-year-old needs is different, and the way services should happen should look a little bit different. That it's goal-oriented, it's a goal-oriented process for assessing their needs for both personal development and stability. You know, keeping their eye on the prize and working with young people, and that it's a coordinated set of services focused on assisting in maximizing the immediate opportunities for young people that include work readiness, constructive future planning, and really has them thinking about, yes, the here and now, but really also focused on their future. Next. So bilateral case management is a term that we're gonna talk a little bit about today. And I thought in the breakout session, Eddie, you lifted up and talked about bilateral communication. So I really wanted to pick up on that. I love that. So bilateral case management, I think oftentimes we think of case management as being a one-on-one service, right? So it's a case manager working with an individual young person, helping them to do, eliminate the barriers that they have toward their success, and working on their challenges while maybe doing some future planning with them. Bilateral case management frames case management in a different way. One, it's a system level approach that really speaks to the need for collaboration within an organization and across systems. Okay, so we're talking about coming together at both the system level and even within the organization and across those systems to make sure that is that network of services to support the young person to get them across the finish line, right? And then it's a participant level strategy that requires active engagement of the client or the participant, so they're driving their own plan. Okay, so by definition, bilateral case management, it's a systems level approach, it's a participant level strategy, but it doesn't always need to be a one-on-one approach. So if you think about in terms of, for the young person, just as working collaboratively across staff within a program and across programs to provide a safety net, having young people come together in groups is a case management strategy that sometimes gets used, doesn't always get used, but can be really effective way of working with young people. It also gives them an opportunity to develop a peer support network, and has them not feeling quite so isolated in whatever their challenges might be. So that, that they're not in it alone. There's other folks who may be experiencing some of the same challenges, and they can support one another in that effort. Next slide, Sarah. So at the system level, we've been talking a lot about the cross collaboration. We want to continue to do that. So most programs don't offer all of what they need, but working together and fostering that collaboration across the service areas, and to do that in a case management framework is what bilateral case management approach really calls for. Developing, and we saw this in the partnership development, developing clear guidelines for decision making. Who are the decision makers? How are decisions getting made? And having that clearly mapped out across those systems. Having clear data and information sharing agreements in place for confidentiality. This all, this mirrors what we were talking about in terms of overall relationship development and partnership development. This is the same exact framework at a case management service approach as well. Using case conferencing to maximize supports without duplication. So coming together across agencies, multiple staff who can put their heads together to figure out where a young person's at and what they need most is going to get them further. And then revising the traditional modes of operation when they don't work in a participant's best interest. So if you've tried something over and over and over again, there might be a different approach that you'll need to take. And if you have multiple heads wrapped together around a particular young person's case, you'll have more thought partners and a greater likelihood of figuring out the best service strategy to meet their needs. At a participant level, we want to emphasize that young people, we want to make sure that you're identifying and prioritizing their personal strengths and their needs and translate them into a set of realistic goals for them. And again, they should be the driver of their plan. I think oftentimes the adults working with young people will want particular things for them, but the young person needs to be the driver of their plan and set realistic goals for themselves. And the role of staff is to support them in those efforts. Develop an action plan for achieving those goals that's transparent to all stakeholders. So everybody who's working with a particular young person, including the young person themselves, needs to be on the same page and understanding what the goals are for that particular young person. So all stakeholders to be on the same page. Access resources needed to pursue those goals and across institutions. Again, your organization might not be able to meet all the goals of a particular young person. So through your partnership, you want to be able to access resources to be able to support the young person. Help the participant access those services on his or her own, because our ultimate goal is to reduce their dependency on their case manager. And then offer case management in groups as well as individually, so participants have a peer network, right? So if we're doing our work well, we work ourselves out of our particular young people needing us so much, and having them have a peer network for support is also a really good strategy in helping them around their own self-efficacy. Okay. So tell us about your practice. So we have a poll here. Does your current case management practice include collaborating or case conferencing and information sharing about the youth and young adults that you're serving? So this is a simple yes, no. And this is, do you have a practice of doing this, or is it optional? It's left up to individual case managers. So it looks mixed. So a little over half say yes, that is the practice to do case conferencing and collaboration and sharing information across providers. And about a third of you are saying it's left up to the individual case managers, meaning it's not happening on a systemic level, but happening on an individual case management level. Okay, that's helpful to understand where folks are at. Okay, we'll go to the next slide, Sarah. Thank you. All right. So shared case management. I mentioned this before. We want to talk about some common language, some common tools, a consistent framework. We want to reduce those service gaps and support case conferencing as a way to share. We're going to look at a couple of tools that are within the category of evidence-based practices. And evidence-based practices means they have been researched, they've been evaluated, they have been proven for efficacy. And so the language and the tools we're going to talk about now fall under the category of evidence-based practice. So some of you may be familiar with this term, sort of the stages of change, right? So I see some heads nodding. Thank you for that. As a way to think about meeting young people where they are. And so I think in some of the breakout groups, I've heard you say, or even in the opening polls and in the earlier part of our session today, folks talk about young people might not be ready to participate in education programs. Some of the young people I'm working with don't have very good follow through. And so, if we think about their behaviors in terms of where they're at in their head, in terms of readiness to embrace change and to really receive services and work on their service plan and make some changes within the way that they've been operating, these stages of change are ones that are known to be sort of evidence-based practice of where folks are at. So if you think about in terms of where people, what their beginning point is, you'll see in these two columns on the left in the pinkish color are, the starting point is the pre-contemplation, and on the right in blue is what they may respond if you're offering up services. So pre-contemplation is you're trying to engage a young person in your program model, but they are just not ready to do it. So they're telling you nope, I'm not interested. I don't want that service. I'm not going to do it. I'm not going to go to the GED program. That would be considered pre-contemplation. Contemplation is, it's sort of they're scratching their head and thinking, well, maybe I will go to the GED program. I might be interested in that. So they're contemplating making that change and engaging in that particular service strategy. The preparation stage is they are getting ready to do it. So yeah, okay, I'm going to sign up for the GED program. I know it's going to be on these 3 days of the week. So they're planning for engaging in that activity. The next stage is action. So they're actually doing that activity. So they're going to the GED program. They are participating. They're making progress toward their goals. They start taking the test. And maintenance is, they're in a regular groove and they're keeping going. But we know that this, it is not often the case that somebody goes from pre-contemplation into the maintenance phase as a really straight and narrow path. And sometimes folks will skip a step, or they may revert and go back to a previous step. So when life throws them a curveball, or they hit a bump in the road, they may get bumped to a prior level in the stages of change. So really using bilateral case management and thinking about the service strategy in terms of where each individual young person may be in their stage of change and where they are in their head is really, really important in thinking about the service strategy. Another tool, and this is actually a training that will be offered in this series in June, is motivational interviewing. And this is a particular technique that's an evidence-based approach to working with young people and to use in-case conferencing to have them address sort of what's going on in their own heads. So there's a particular strategy, and I'm not going to go into detail because we're going to offer 2 cohorts of 2-day trainings on this particular tool and technique, but it's a really good way to work with your participant base to get them through open-ended questions, to getting them to affirm what their thinking and believing is, to help them to reflect on where they are at, and to be able to summarize where they're at as a way to get them to process where they are and how to move them into a next phase. So it's a particular technique that's incredibly useful. And again, I would encourage you all to sign up for that training, which is actually offered through JRI. Next, some of you may be familiar with CBT, or cognitive behavioral therapy, or theory and cognitive behavioral interventions. This is an evidence-based approach which is focused on the strategy to change the thinking patterns of young people. So, sometimes young people will, they're struggling with something. They react to something that somebody else says or does, and using CBT techniques or interventions really gives young people and the participants strategies to de-escalate, to think about their own behavior and their actions and their motivation as a way to have some and to really own and to exert some self-control. So it's getting them to recognize the way that they're thinking and how sometimes that thinking can create issues or challenges for themselves. It helps them to gain an understanding of their own behavior, and the motivation of others, and to be able to stay within themselves in terms of problem solving. It gives them really concrete tools to cope with difficult situations, and it helps them to develop self-confidence in their own abilities. So there are strategies within a CBT framework that really gives young people an opportunity to exert some self-control, so they don't feel so out of control. And then the next one is a trauma-informed service delivery. So we know that most folks have experienced some sort of trauma, and certainly with the young people who experiencing homelessness have experienced trauma. So we want to, as staff and folks supporting them, recognize the signs and the symptoms of trauma. Oftentimes things like aggression, depression, anxiety are signs of trauma, and to, in your practice, avoid as much as possible re-traumatizing young people. So one of the things we talked about early on, if you have a young person that you're serving in your program and you're referring them to another program for another set of services, if you are partnering and collaborating to avoid having them retell their story and what challenges they have over and over and over again, could be one way to avoid re-traumatizing them. Okay. So we're going to talk a little bit about using this as a framework. So those common strategies and those common terms, and we want to use the framework so we can come together and actually serve young people in a collaborative way. Sarah? So we're going to do a next breakout group, and we're not going to cut you off this time. So you will see in the chat, Anna put in, it's the same document that you had the first time. If you hadn't opened it up, you can open that up for this breakout group. In there is a scroll down to page 2, and you're going to work on a case study. So in your small group, and you're going to practice a case conferencing model that you can use as you're working with partners, that has, and the particular tool has the steps laid out. So identifying who you're going to talk about in that particular case conferencing session, talking about the strengths that the young person is bringing and what their challenges are, and what services, identifying what services that Jorge is the young person in this case study he's engaged in currently, and what services he might need next. So it's really an opportunity to do some problem solving and some action planning around a particular young person. You're not going to do that first step of deciding who you're going to talk about, because we're giving you who you're going to talk about today. So Jorge, age 18, is the focus of this case study. So you're going to have, you'll have until 12:30. So you'll have about 17 minutes to engage in this conversation about Jorge. And then when we come back together, we'll do a quick share out. All right. Well, welcome back, everybody. We're closing it out for the day. We're on the finish line, getting to the finish line. So I'd love to hear, I was able to be in a couple of groups. Would love to hear what folks talked about in your groups in terms of the strategy in serving Jorge. So anybody can jump in.
I can go for our group.
Great, thanks, Carlos.
You're welcome. So what we discussed I mean, the individual is definitely facing a lot of barriers, and we've kind of faced, we've had instances, same kind of examples occur with our clients. So, what Tariq had mentioned was kind of, working to chopping down the barriers. So a lot of the barriers that he faces is probation. He dropped out of school at a young age. The brother was murdered, so a lot of trauma that kind of could be reoccurring or just kind of starting up again. And then housing as well. So, that issue as far as couch surfing and not wanting to put his mom at risk of losing her housing. And then we talked about some of the kind of things that are going well for him, or things that are, good for him right now, is that he's worked before. He's had some work experience for, a month or so, 6 weeks. He does have some ties to the community. And that kind of awareness where it's like he knows he doesn't want to jeopardize his mom's housing. So he kind of has that kind of, he doesn't want her to lose that. So he needs to figure out his situation out. And then we talked about kind of as far as services and connecting with him, kind of, have him come up with what's his plan or what he needs assistance with, and using that motivational interviewing that Tariq had mentioned, as far as like, how can we be there for support? How can we, what do you really need right now? And then tackling those barriers one by one. So as far as housing or anything else like that, kind of meeting with someone that, does that type of work and is able to do like housing search in the meantime. And then also trying to look into IDs, if he has any IDs, because that's going to be important if he does want to work later on, or even just in general, having the proper documents. If he's moving from home to home, making sure he has that, stabilized for him. And then maybe looking into a training program if, he doesn't, if he needs more experience with trying to find employment, or just in the meantime, getting some training out the way. And then maybe kind of recenter around the education component, where it's like, this is going to come up again. Right now, we need to tackle these kind of main barriers, but education is going to be an important piece later down the line. So kind of having those options provided for him. And we kind of discussed like trying to meet with him in person and kind of gauge to see like his interests and his mood, kind of everything that we have to offer. Like if it's going to be a challenge to him, how can we break that down, or, share out our experiences with it. And kind of just, everything that comes up, there's a solution to it, or we can find a solution to it.
Great. Thank you for that, Carlos. Another group, your strategy, how would you work with Jorge?
Susan, I guess I could go again.
Great, thanks, Lyndon.
Yeah, my group, we kind of look at what would be our initial approach to engage the young man in these circumstances here. So first of all, we will try to learn as much as we can through the intake process. We consider going through the process of apologizing for the person having to repeat that story again. We're looking at what are the conditions on which we received the participant. Was it a warm handout or handover we got from thing? Questions about what we really need to know. And for us, we felt important that we had to be able to identify the barriers that affected them, whether or not it was safe for him to meet in person, whether or not their geographic location, and if they were, whether or not we have knowledge about how to deal with him in those circumstances, because young people normally shut down when it comes to talking about geographic location and talking about affiliation. So how creatively we go about ascertaining whether or not the geographic location is tied in terms of gangs and other barriers as it relates to geographic location. It's important for us to understand too what other agencies are involved, bearing in mind that he has been experiencing trauma since the age of 13 with the loss of his brother. What services are already in place for us to be able to deal with that? So the information gathering is so important for us. And interestingly enough, in our group, we spoke about what things, although we have situation to deal with, what are his hobbies, idea things that he likes to do so that we can have a nice blend of attacking the case at hand and or dealing with some of the other barriers to put a little bit of fun in it. We came up with the approach of saying that there certainly are short-term goals, for instance, the employment, any certification, completing of housing application. Look at the longer-term goals, the housing certainly, and what are one of the factors that would really help us in terms of moving everything along would be terms and the conditions of the probation, because that will kind of dictate what work is like, what type of work we're looking for based on the job hours. So is there a barrier around, as I said before, a curfew? What are some of the things that are mandated by the court for him to be able to kind of work on? Those are the things that will help us in identifying how to set up a plan, action plan, short, medium, and long term. That's what we have.
Great. Thank you for that. So I mean, what I heard in several of the groups are sort of really getting to know the young person, and if you have the opportunity to meet them in person, to do that. Screening for barriers. What are the things that might be holding them back, and working through some of those challenges. Gathering as much additional information as you possibly can. And then starting to work on both some short-term goals and then thinking ahead to the longer-term goals. Anything else that anybody who was in one of these groups or another group that you wanted to lift up?
Our group sounded very similar to those who have shared so far. I think that a couple things that we focused on was access to technology. Like, what technology does he have? Does he have a computer where he can like search for jobs or housing? Does he have a phone? And then also if trying to ask if like trauma and understand if trauma like plays a role in like the homelessness and also his ability to kind of keep a job. And if so, and if Jorge like wants services for that, we would like provide referrals to agencies that can support with trauma.
Yeah. Okay. Great. Thank you for that. Okay. So I think it sounds like a similar approach across the groups. Again, sort of the wrapper of our session today is really about collaborating across agencies and making sure, I love that there was sort of similar thinking in the approach with Jorge, and thinking about how you set up that framework so you can have these conversations in a more systemic way will carry you further in serving the overall population. So if you think back to the beginning of the session and some of the challenges that young people lifted up in terms of making sure that they weren't getting duplicated services, that there was coordination, that they were getting a level of support from staff, gentle reminders, having opportunities to engage with staff, but then putting a framework in place where you're able to work with other agencies to best meet the needs of young people is what's going to have you positioned to better serve young people in the long run, and to lift all boats in terms of programs across both networks if you are working in a collaborative way. So thank you for that. We're going to close us out today. I really, really appreciate all of your time and spending several hours with us this morning and into the early afternoon. We have a survey. We really want to hear from you about what worked and what else you need. One of the things that a couple of folks have asked about is getting the list of folks who participated in today's session. And so that way you can start to build out your network of cross-system providers. So we will get that out to all of you. But we'd love if you could take a few minutes to take the survey. So it's up on the screen now. If you can click on that and fill that out. Any other takeaways you wanted to enter into the chat? That's great too. The next session in this series is May 12th. It's from 9 a.m. to noon, and it's developing logic models and metrics for setting up a framework for planning in your programs and evaluation. So that session is May 12th if you haven't registered for that, but you can register for that one. And then there's a next session on May 24th, which is on program design for employability and employment programs. And then the last sessions are at the week of June 6th, and that's with JRI doing motivational interviewing. So we hope to see you at one or any of those. So if you could take the survey, that would be great. Thank you so much for participating today. We really appreciate it.